Thank you, Vincent. Vincent is actually one of the big reasons why I decided to embark on this academic journey. So just wanted to put it out there. So today I have thanks for coming. I have basically a talk on the paper that that me and some colleagues at Duke NUS as well as UMass Boston did together. It's really about this idea of understanding the digital divide and its various dimensions, right? And Vincent, I told you that I guess my interests are in, I tell people that my interests are in, I study older people and whether they have friends. And so this is part of that line of research. So let's, without further ado, let's move on. So a small caveat first is that this paper is already published in the Gerontologist. So it's unlikely that if you make any helpful suggestions, we can make any changes. But I'm very happy to hear any ideas you may have for future work and something that we can take up in the future, especially since now we have some new data on this. So I've kind of done away with the academic theoretical introduction. I'm going to give you a more informal version of how I got to this research topic. So let's go. Okay, so first, I think we can all agree that using the internet for services is this is because a lot of government services and all that are being moved online, and things like SingPass and food delivery, and I mean the COVID-19 pandemic has made this even more pronounced. The state is trying to ensure that seniors are not left behind, right? We have all this digital ambassador scheme, and we have a lot of people who are trying to kind of help older adults look at how they can communicate still, right? Using digital platforms and making sure that they don't get excluded from different services. But we don't really know, I think we don't really know what the current situation is, right? We have kind of an idea from here and there. The COVID-19 pandemic seems like to tell us that actually a lot of older adults are very lonely and they're not tech savvy. But previously, there were reports that telling us actually they're doing very well, right? Like this report that says a majority of Singapore seniors are web savvy, right? For this one, I can tell you the reason why this is because this reporter basically interpreted the statistics wrongly. So this is among people who use the internet, they use it often, right? It's not among all people that use it often. Then we have this IMDA statistic that tells us that, oh, look, 76% of seniors use a smartphone. So here I'm going to use an example to explain to you why this may not be a great indicator of older adults who have access to internet, right? So this is my grandpa, right? He's using a smartphone, right? He recently got this smartphone. So he's part of the 76% if they do it again next year. If you notice, if you look at the screen carefully, you realize that there are really no apps. That's because he doesn't really know how to use any of the apps, right? He uses the smartphone like a dumb phone. And I think, to be completely honest, I don't think he has data on that phone. So he has a smartphone, but he doesn't use it like a smartphone, right? And the only reason why he has a smartphone is because it's very hard to find dumb phones nowadays. At the same time, and this is where our interest lies, is that I find that for him it's very difficult. If I want to Zoom him or if I want to kind of talk to him, it's difficult because number one, he has hearing problems, right? So it's very difficult for him to hold up a screen in front of his face and then do kind of Zoom call because it's just not loud enough. Recently, he also kind of had an eye operation, so he also has issues with looking at things clearly, and sometimes these smartphones can become small and the apps can be a certain way. So we're often told that seniors don't use the internet because of two main factors, right? First is access. So that's why we have something like the Home Access Program by IMDA. They have this to help make it cheaper for older adults to get access to the internet. Second is skill, right? So therefore we have this Digital Ambassadors Program. They don't know. We want to teach them how to use apps and stuff like that. But what about health? So we are interested in whether there are specific health conditions that make it more difficult to access the internet. And this is still a question even after this study. We want to know how many people have health issues, right? Kind of when they access the internet, and how how much this is a barrier. So my co-authors and I wanted to find out, number one, the general state of internet use among older adults in Singapore. Two, how many of them have health-related difficulties in using the internet? And last, what is one possible mechanism in which they can affect older adults' quality of life? Data for our study are from wave one of the SIGN study, for short. This study is funded by Ministry of Health, and it's run by the researchers at the Duke US Center for Aging Research and Education. It is a national survey of community dwelling Singaporeans aged above 60 years old. The first wave was conducted in 2016, 2017, right? So we have a total of completed interviews, 4,549 interviews. For the analysis, for this specific analysis, we excluded people who did not belong to the three major ethnic groups because there were very few of them. Three major ethnic groups are Chinese, Malay, and Indians. We also excluded those who responded through a proxy because quality of life was not accessed through the proxy. Also, there was a small percentage that had missing values on various interests. So how we went about this was that there is usually a list of what we call instrumental activities of daily living. These items try to assess how well a particular older adult is able to live independently, right? And so we have here prepare their meals, leave the home to purchase stuff, take care of financial matters, use the phone, and all these things that you kind of need to be able to do to live independently. So we added this item using the internet for any email or other purposes, because if you realize some of these things like financial matters, they're all moving online, right? Using the phone, people now use kind of internet enabled, for example, like WhatsApp or Zoom or things like that. Even purchasing necessary items or medication, you can do it online. So we were interested in this. We just added this item to see how it would do. And the question was this: do you find it difficult to perform this activity alone without the assistance of someone or assistive device due to your health or your physical state? And this is the standard wording that we use for the other IADLs as well. The response options allowed were: it's difficult, it's not difficult, and I do not do it for a non-health reason. So some of the technical details I'll try and go through quickly. First, in the first step, we wanted to find out who are these people who have these difficulties, right? And so we estimated the multinomial logistic regression model. This is the likelihood function for that. And we used a vector of covariates, including age, gender, ethnicity, education, marital status, housing type, whether they were living alone, the children, and a whole bunch of health variables, just to see who are more likely to be in which group. So from here, we could already answer our first two research objectives, right? First is about the general state and what's the prevalence. And I'm going to present to you just some highlights. If you want to look at the details, you can look at the paper. The overall distribution shows that only 36% of older adults in Singapore use the internet without difficulty, right? There are 36% here who kind of are well adjusted to that, whereas 56% of them don't perform the activity because of a non-health reason, and 7% says that it is difficult. Men were more likely to face health-related difficulties, but this is also because you see they are more likely to use the internet in the first place, right? So this difference is not different from this difference. We've also found that those of Malay ethnicity were more likely to face health-related difficulties. Now, this looks like a small, not much difference, but there is about a 3% difference. And given that the population average is around 7%, so the difference between the Chinese and the Malays here are, I think, around 7 and 10%. So that's not small. I mean, that is 3% is a small, but compared to the reference group, is not small. We are not exactly sure why this is the case, because we control for quite a large variety of factors, including health problems. So this is something that I think we can look at in future research. Those with a lower level of education were doubly disadvantaged. So you can see here in this pattern that those who have lower education are the most likely not to use the internet, right? But at the same time, they are the ones who find it difficult. So they don't use the internet, and when they do use the internet, they are more likely to face health-related difficulties, right? One reason that we gave in the paper was that maybe lower educated individuals are less able to manage their own health conditions, and therefore there's the severity of the condition that we did not consider in this model. Number of IADL limitations were also associated. Interestingly, as a side note, I think we tried to scale it with the other internet use variables, but they did not really scale well. So it's kind of an interesting kind of separate kind of limitation, but highly correlated still. I think we're still trying to explore why that is the case. Now, to address our final research objectives, which is to find out how these health-related difficulties affected their quality of life, we did a mediation kind of analysis, right? And so for causal interpretation, mediation requires this assumption called sequential ignorability. Now, it sounds like a big word, but it's very simple, right? So people who are more likely to face difficulties are selected into that group, right? So what we do is we're just trying to balance it out so that we compare like to like instead of trying to compare apples and oranges. So we're interested in the mediated effect and the direct effect, trying to decompose the main effect into something that goes through one pathway and then something that goes directly to that, right? So there's a pretty simple model. And this is what I said just now. So how we kind of balance out the able to compare like to like is using inverse probability weights. And so this step is achieved from the previous model with the multinomial models, right? We looked at all these different probabilities, and you use that to calculate inverse weights. And then the second step is you need to be able to do sensitivity analysis. It's not something that is directly testable. Okay, so all the math aside, we find that we surmise that first that a key reason why older adults use the internet is to connect with friends and family, and we see that particularly in this pandemic, right? That is a main pathway for them to. This is the main reason why they use the internet, and this is the same in other countries such as Canada and the US. One of the main reasons older adults use the internet is to kind of connect with friends and family, whether it's kind of a synchronous type of thing or an asynchronous type of thing. It is primarily used for social purposes. So we measured quality of life using the CASP-12 scale, which is quite widely used. It's used in quite a number of other surveys in Europe and the US. We also looked at social support networks by using the Lubin social network scale, which assesses closeness with family and friends outside the household. So these are our findings. Essentially, we find that a large part of the negative relationship is that if you have a health-related difficulty, you're likely to have lower quality of life. And why is that the case? That is because you have lower social networks. So that is the case between the difficult and the not difficult group. Between the difficult group and the do not perform group, things are slightly more complex. But here, I'm going to try and not dwell too much on this relationship because it's not generalizable. Okay, and so I told you just now that the second step is not testable, but you can do sensitivity analysis. And so we did sensitivity analysis, and we find that the results are quite robust to omitted variable bias, which is confounding or pre-treatment covariates is what you want to call it. So in order for the indirect effect to equal 0, the correlation has to be this big, and that's quite a big correlation term. So to summarize, many older adults age 60 plus do not use the internet, and a sizable proportion of them have health-related difficulties. 7%, depending on how you want to see it, is substantial. It is substantial to me. Every 1 in 15 or 1 in, for Malays, 1 in 10. Those who are male, those who of Malay ethnicity, those with less education and more IADL were more likely to experience these difficulties. Those who have these difficulties have lower quality of life compared to those without such difficulties. And this association is mediated by the strength of their social support networks. So what does this mean? So I give 3 suggestions, right? So one, simply teaching skills and offering cheap internet access is not going to fully address this divide. Second, we always think that online communication tools are meant to benefit seniors with physical limitations, right? Because they don't have to travel out of the house, they don't have to be totally mobile in order to use the internet. But for some people, their health issues stand in the way even of trying to use the internet, right? So there's kind of a compounded thing going on there. Oops. Yeah. Third, we should identify what these health-related difficulties are. So in our study, we did, as I told you just now, we put a large amount of health-related covariates to try and find out what kinds of conditions are related. We didn't find very many substantive results there, and I think we suspect that it has to do a bit more with fine motor skills and other sorts of difficulties that are not well captured by this diagnosis of, for example, chronic illnesses or IDLs. So there's an area that we probably will try and look at in the future as well, trying to find out exactly what people mean when they say they have health-related difficulties. So some limitations, it's cross-sectional, so we cannot rule out reverse causality. We do have a second wave of data, so we can look at that. Second, as I said before, they did not specify the exact kind of health-related difficulties. Third, it does not specify a single activity for internet use. So you don't know if they're using the internet to go shopping or to kind of do social networking or thing like that. But we can kind of get a general idea from the mediation model and stuff like that. Lastly, we did not find very strong associations between the measured health variables and health-related difficulties, as I said just now. I think that's because we don't really capture that fine motor kind of movements and things like that. So we are thinking of next steps. The natural next step is to find out exactly what kind of health difficulties that they face. Of course, there's other questions that we're interested in as well, as like kind of what activities do they use it for, how many gadgets do they have, and these are things that we will also try and look at as new waves of data come in. So any questions or suggestions for associations or patterns that we should be looking at are very welcome. I want to acknowledge my co-authors. Rahul is here. Emily, I'm not so sure. It is probably midnight for her right now. I want to thank the Duke US Care for facilitating and running the study for the data that I use, and the Ministry of Health for funding it. And that's it. I am well within my time.
Yes. Thanks so much, Shannon. This leaves us a lot of time actually for Q&A. So I'm happy to open the floor to anyone who would like to pose a question to Dr. Ang. Feel free to unmute yourself and just pose the question directly to him. Maybe I can start with a question, Shannon. And the question I have is, internet use. Does this include the use of WhatsApp? So they may not be, the seniors may not be making reservations or, as you say, making purchases and all that, but they are using WhatsApp to talk to family and friends. So my question is whether your estimate of internet use is in fact underestimated, if it does not in fact consider, lower barrier sorts of engagement, with the network, for example, WhatsApp and so on. Mm-hmm. So that's my first question. The second one I have is, what exactly is social support network? Right. Right, because you say that's a mediator, and the internet does provide access to social support. In what form does that network take? So that's just two for starters. keep it brief so that I can
let others ask.
Leave, yeah, sure. Let others ask. Yeah.
Sure. So the first question, I think it is, I'm going to lump it together with someone in the chat who asks, Wang Xizhe, I think, who asks about rideshare apps. So what do older adults consider internet use, right? So if you can see, the question that we ask them is very general. We ask them, do you use the internet for email or other purposes? And you can use your email on your phone, you can use your email on your computer, you can use your email in the library. It's very broad, and that's why I included it in one of our limitations. But I don't think that is necessarily a flaw. I think this is not about, I think if you think of it as how older adults perceive themselves to be able to do something. So for example, like even things like prepare your own meals. What is prepare your own meal, right? Like is making instant noodles preparing your own meal, or do I need to do some chopping and stuff like that? Those are so these are activities that they view as important for themselves, and do they see themselves as being able to do these activities? Of course, I think there is some variation in terms of what, for example, someone who is highly educated thinks of using the internet versus someone who is less educated, maybe have a different idea of what it means to use it. Some people might count WhatsApp in, some people might count WhatsApp as not in. And I think the point here is whether these activities kind of interfere with their daily activities, right? And I think that is what the list of IDLs tries to capture. That said, we do have, I think now CARE has collected a new wave of data, and we can, which with in line with this paper, they managed to kind of put in more questions on technology use, being able to see exactly what use people are using it for, and we can always kind of look at the relationship between these. As for social support networks, that is primarily perceived social support networks. So it asks questions like, how often do you see your friends, and do you feel close with them? Kind of slightly more general questions on closeness to family and friends. Yeah, you can find this skill online.
Thank you.
Say that, yeah.
Yes, Chu Shi, I can see your hand.
Yeah, hi. Shannon, very good. Thank you very much. And I think the study has a very good policy value to understand this. I have two questions. One is for clarification. So did you ask whether the senior owned a cell phone or not? If for someone who do not have the cell phone, the difficulty actually mean differently. Okay, that's my first question to clarify. My second question actually is similar to Winston's concern on the social support. Okay, I believe your mechanism is very right. That is using cell phone will promote social support and social connection, then increase the life quality. But for your case, I mean, most of them are 60s, they are doing grandparenting. And social support, the closeness might mean the family ask them to use the cell phone. So the direction are different, you know what I mean? Namely, you have to pick up my kids, then grandpa has to have a cell phone. Yes. So yeah, these two things, please clarify. And the last thing is, what is the age range of your sample?
So 60 and up.
So what is the oldest old? How many oldest old do we have?
Few, I think. Above 90 something, I think.
I see. Yeah. So yeah, probably, I just have one suggestion because my own interest is this kind of sensory disability. So those people who cannot see and who cannot hear, they may, but these people might over 80. I think that makes sense to check these kind of really sensory disabled people. Right. Which make some sense. Yeah. Okay.
Right. So for that last point that you made, I'm going to answer that first because that's the easiest one.
Okay.
We do include kind of
the sensory, right?
Visual and hearing difficulties.
Yeah. May I know what is the prevalence of it?
So, I guess, yeah.
Maybe later we can discuss about it. But Shannon, I will be very interested. Later we can discuss like those people who have both.
Here, you can see the prevalence.
Let me see. About 5%, right?
Yes, for both.
How many people have both? Do you have any idea?
I didn't look at that. Yeah, but
Yeah, that might be a
smaller
group we
percentage.
could target. Later we talk. Yeah,
Right, sure. Okay, so you had two questions. First about gadgets, right? So, like I said, we weren't really sure what we would find given this item. So it was very general in the sense that we were just kind of testing it out. So we don't have that much information about whether they have a smartphone, whether they're using it on the smartphone or not. But now we do. So
okay, good.
So keep your eyes peeled.
More
will come out of this. We'll see. We'll begin to look a bit more at this specific what they use it for and what gadgets they have. So in the second wave of the survey, we do ask, like, for example, do you have a smartwatch? Do you have a smartphone? Do you have a laptop and stuff like that?
Okay.
Second question.
Okay, sorry, I interrupted.
Oh, second question. Remind me, that was on that was on reverse causality. So no, I have no answer for you for that one. I think I think now that the second wave is in, we can do a bit of a two-wave mediation, and that is will, I guess, be a bit more satisfying for people.
Okay, thank you. Yeah.
Shannon, Chris Ho has a question about whether if you know that they have internet at home or are these data plans, right? So that's one. And then Ling Ling has a question about whether the difference in the level of internet use is in fact modified by, the configuration of the living arrangements. You want to comment about on those two?
The last one, I don't know if we have in our table. We do have living arrangement. I guess our living arrangements, we only look at living alone, right? So you can see the difference here. Of course, those who somehow those who live alone are those who don't use the internet a bit more than others. So that's I mean, we do have more granular data on this, and we can talk about it later. On the first question, the answer is quite easy. The answer is no. We don't know if they have internet at home or data plans, and that I think is always part of future things that we can do. Like I said, the science study was really a study to kind of look at overall population health. It's a very health focused survey. Of course, we can think about doing another kind of study with tech, more tech focus, or kind of following up maybe with a smaller sample with tech. I'm happy to kind of talk ideas, but at this moment we do not have those information.
Okay. Questions from anyone on the floor? Yes, Irene, I see your hand. Yeah.
Hi, Shannon. It's Irene. My question is kind of related to all the questions that are being asked, because I think this notion of internet use can be quite vague and contestable among elderly. So, like, latching on to Vincent's first question about WhatsApp, right? I wonder whether in your survey there's some sense of being able to like tell whether the elderly respondent actually knows the distinctions of these things, right? They might see the question and then they think that they're using internet, but actually they don't, then yeah.
Right. So yes, that's also something that we did think about. For me, at least, related to Vincent's question, right, about what exactly do you mean when you mean internet use? And at least for this study, I see it as a matter of their perception, right? Do they think that they can use the internet? And that matters for a lot of other things, as they kind of like whether they can do such an activity or not, and their perception of the activity. As for specific activities, we do have that information in the second wave. So things like very specific things, like whether they kind of read or send an email, whether they surf a website on the internet, or kind of send an instant message or text or photo or video on WhatsApp, WeChat or Messenger. We do have those, and so we are going to look at those a bit more clearly.
Yeah, for example, I think a lot of elderly, they just use WhatsApp to forward pictures, right? Or just Facebook to just like. So
right.
That
so
kind of use versus like more advanced use. Yeah. Okay,
yes.
Thanks.
So we do have in the second wave, we do have items there. I just want to say also that with regard to the smartphone question, I just put up some of the code that I have and looked at a bit at the second wave, and I will tell you, I cannot tell you the specific proportion, but I'll tell you that actually quite a substantial amount of people, say 20 to 30% of people who have a smartphone, don't use the internet for any of these activities, any of the activities that I just listed to you: email, surf website, instant message, read or post material on like Facebook, or do a video call, right? Actually, a lot of them don't do those activities, even though they have a smartphone. So that goes, I guess, goes to show how complex this is, right? Number one, do you have a smart device? Number two, do you use it for certain activities? And number three, do you perceive yourself as being able to kind of use these activities for services and things like that?
Other questions? Okay, I have one here from Poonam. Does education, what role does education play in internet use, and to do with reading and writing? Shannon, you want to comment?
Right. So here we have the predicted probabilities, kind of marginal probabilities for how the distribution is. So you can see that lower educated folk tend to not, or at least perceive themselves as not using the internet. And when they do, there are more difficulties in this. Now it's unclear what these difficulties are, but I think we kind of suspect that that some of these difficulties are because of health conditions, management of health conditions, right? So maybe if so I think like there have been other work on, for example, compliance in taking medication and things like that, and perhaps those who have lower education are more affected by certain health conditions because they are less able to kind of self-manage their difficulty. Of course, nothing is to say that that they may also perceive that their cognitive function is not as good as other people, and maybe they see themselves as maybe not as equipped to deal with things and agree that and use this internet. Yeah, it's hard to tell why they report things like that. It might be a reporting difference, or it might be a real difference, but these differences are quite huge. So I would think that there is a real difference, and we do need to understand a bit better why this is so.
Shannon, Leng has a question about whether, with all this data that you have, whether in fact there will be a follow-up study using the qualitative approach to tease out some of the mechanisms.
Yes. So I agree that that a qualitative approach is good, and we need it, and happy to collaborate to apply for money to do this. And yes, I in fact think that this area of research is very important, especially as we kind of very quickly move towards this smart nation type of thing.
Chris has a question about whether asking you to elaborate on the second model, mediation.
Okay. So the second mediation model, in terms of I guess this is a technical question. So the mediation model is really just if you think about it, it's a series of two regressions, right? One is the regression of everything else, regression of the outcome on everything else, and then the second regression model is the regression of the mediator on everything else. And then you're trying to find out what is the difference between the two models in terms of something predicting the main thing predicting the outcome. And so all the other technical details, like what is the ACME and the ADE and all the details about weights and stuff like that, they're all just trying to account for selection effects. So the people who have a difficulty are different from the people who do not perform, and we already saw that here, right? We already saw that here. But the fundamental problem of causality is about comparing apples to apples, right? You don't want to compare apples to orange. So the whole, everything that I've done here is just to correct for that difference, right? That trying to make the people who have a difficulty look like the people who don't have a difficulty in comparing apples to apples. And the last step where we talk about sensitivity analysis, that's just a way to kind of test how strong and how robust your results are to a certain specification of the model, and that requires looking at the error terms, right? Whether the errors from the mediation, the regression of the mediator is related to the one from the outcome, and try to see how much do they need to be related in order for you to for the effect to be zero.
From the looks of it, you seem to have pinned down to some extent the causality issues you say, besets the research. Do you have any comment about that? That is the causality issue? Have you at least partially dealt with the causality issue? And because you seem to sort of pin the blame on the fact that you don't have a wave 2. But in fact, with all of these treatment and as you say, apples and apples, does to some extent at least partially deal with it. Just a quick comment before going to Benny, because Benny has a question about assistive technologies.
Right. Okay.
And I see him on screen here.
Okay. I answered the cross-sectional way because I didn't want to go into a philosophy of what I think causality is. But since you asked, I'm going to
keep it short
and kind of do a short version, right? Okay. So I think so causality, the fundamental problem of causality is this potential outcome problem, right? If you compare same to same, normally dealing with causal issues in a longitudinal form is going to look the same. With the wave 2 thing, you can look at temporal priority, but temporal priority comes with a lot of other baggage, right? And people have shown that sometimes it's worse to use this temporal priority to kind of establish causality because of the there's assumption of no dynamics among observables, but let's not go there. So I think yes, I think in terms of whether I'm satisfied with the causal claims that I made here, I am. I think in terms of theory and what we've seen from other studies that a key pathway from internet to social support and not really the other way around. I think there is some reciprocity, but I think there's a more one direction than the other. I am satisfied with the causal pathway here. It takes different amounts of effort to convince different people, but as personally, I am convinced. With the Benny's question,
Benny,
how would assistive technologies and training to provide to? Okay. So I think the assistive technologies that we talk about here is maybe less on the burden is not with the older Singaporeans. I think the burden is to find out what the older Singaporeans need. So for example, this is a very anecdotal observation, is that I found that older people don't like to swipe. They like to tap, right? They like to press. And when they press, they want to feel something as well. They don't want to just press and have it not react, right? Because you don't know whether you actually press something. And I think that's already somewhat possible, already, because if you have for example, an iPhone, the button has this kind of tactile feel to it, and so I think it's possible to have such things. It's just a matter of designing apps or interfaces for older adults, such as it's easier for them to navigate and to accounts for more, I guess, mispresses or mistakes in what they want to do, and making clear kind of what are buttons and what are not, and what you swipe and what you tap and what you. I think all those things matter to when you have like kind of a let's say, for example, someone who has, I guess, issues with the nerve endings. Those kind of things really matter to them, or someone who maybe Parkinson's or something like that. They all matter.
Okay.
Training. I think MCI is doing. They're trying to reach out to seniors with the digital ambassadors thing. I think as long as they kind of get to the people who like need it more, those people who have quite serious health concerns, I think that would be okay. Although of course the training has to be, I think the training has to be targeted in this case because of from my point of view and from the results, I think using tech can mean a wide variety of things. It can be I use my app to go and do banking, right? And I think for older adults, when they learn apps, how to use an app, they learn how to use a specific app, right? It's not a matter of building a foundation of how tech works anymore. It's more of like do step A and step B. And I think maybe a huge part of our efforts should be directed towards getting them to be able to use, like, for example, video chats or be able to make calls and things like that, and do WhatsApp and stuff like that. The more social side of things.
Any other questions from the audience?
Right. I see
Shannon?
one by Chris actually about the results.
Yeah, he's
So,
pressing
yes.
you. He's pressing you about Model 2.
Oh yeah. So I misinterpreted his question to be about the technical details, but no, his question is about the results. So the second result is quite interesting because this direct effect here is positive, but this indirect effect is negative, right? Did I write something about it? Yeah. So this means that using the internet, even with difficulty, is beneficial for quality of life, right? But the observed effect is smaller because their social networks are smaller. So what does this mean? This means that people who do not use the internet, those people who do not perform, are probably okay in terms of their social support networks. And that's why they don't use the internet. But using the internet still has a positive effect on quality of life. Does that make sense?
Notwithstanding.
Yes, notwithstanding. And so one of the, I think, one of the things that we don't have this in the second wave, but I was suggesting to Rahul that one of the things that we should probably look at is also reasons for using the internet, like whether you use it because you want to connect with friends that you wouldn't otherwise connect with, versus kind of, so in this case, that would have been very useful to see why they don't use the internet. Maybe because they have enough social support, maybe because they don't find the need to. And I think that's important to capture, but we didn't have that here. We weren't able to split the do not perform group into the people who did it because of preference or because of something else.
Any other questions from the audience? Actually, I have a question, and it's because it's you. I'm going to ask it in a very difficult way. You started the presentation by sort of raising a straw man by saying that, you know, the emphasis, the strategic emphasis has often been on access and skill, right? So you say, okay, in order to increase internet use, we have to think about making it cheaper, right? That's the question of access. And you also say that, okay, there's this stereotype, right, that elderly lack the skills needed to engage the digital environment. And then you insert your contribution, which is to say that, but scholars have not considered the potential effects of health. My question to you is this: how do you know that? Have you actually established that access and skills are not important? Maybe they are. Maybe they are. They continue to be important. But in addition to those two, you are then encouraging policymakers to consider the impacts of health. But your paper has not actually established, has not actually proven the point that the first two are not important.
Right.
Okay? So that's the sort of the first point. Then it comes to the question I have, and that is, among the three, what are the weights? Of the three, which is the most influential?
Right.
Are you prepared to say that health supersedes access and skill in determining or influencing the outcome? In this case, internet use.
Yeah. Okay. So my response here is, I'm not trying to make a comparative case. So I'm not trying to say that these are three factors and access is important and skill is important. I think the framing, maybe if I was not clear, that was my fault. But I think the point here is that there are additional things to think about, right? And for me, at least, access and skill are super important things, right? Because they are the fundamental things, right? You need access before you can even use the internet. And then you need some form of skill before your health can prevent you from using something, right? So access and skill are definitely the fundamental things to look at. But what I am interested in is, by addressing these two factors, do you get to the people who are most vulnerable? Are you helping the people who actually need it the most, right? So in this case, what I'm saying is that people, for example, people who are at home and have physical difficulties because they cannot go out, right? In fact, these technologies are the most important for them, right? Because they can connect with others that way. But if you don't consider their health difficulties in using the internet, then the people who need it most are not going to get access to it, right? Even if they do have access and they do have the skill, if they have those health difficulties, then they're not going to be able to access it in the way that they need to. And so that's my angle. It's not really comparing between the three different factors. And you're right that we don't look at the three factors. It's more kind of a adding nuance to the approach than it is to kind of challenge this consensus that that's all we need to do. Yeah.
Thank you. Patrick has a question about e-health literacy.
Haha. Maybe Rahul wants to say something about this. Because
Rahul, most welcome to interject. Yes, Rahul, please.
Yes. So no, I'm gonna
Sure.
just
Shannon, go ahead.
Yeah, I'm just gonna quickly address this because it says e-health literacy. So Rahul has been studying this idea of health literacy and being able to read and being able to understand health literacy. And so I think whether that can be brought into an online kind of thing, that would be interesting. And we do have questions in the second wave to ask whether people go to the internet to look for information on certain health conditions they may have. So yes, Rahul, if you want to add anything.
Just that. I think in wave one we assessed like health literacy in general, English health literacy. I think the challenge with assessing health literacy in Singapore is its multilingual character. And again, what do you assess health literacy in? Do you assess this in context of English or Chinese or Malay or Tamil or dialect for that matter? And do you assess this in terms of verbal or written? So I think it's a challenging question, but at least, I mean, in wave one, we have some data on English, written English literacy. And in wave two, we added a few questions. We expanded on the technology module as Shannon has been referring, and we added a few questions on whether the person has used the internet in general for accessing any health related information. And then for among those who have hypertension and among those who have report themselves to have diabetes, we asked if they've used the internet or any apps for helping them control their blood pressure or understand more about their health conditions and so on. And the prevalence is low. It's not really high. Around I think less than 10% of those with hypertension actually have ever used the internet to access any information about blood pressure, and less than 5% have ever even touched an app for even recording. I think the proportion of used an app for that. But again, we don't go into health literacy there. We have a general question of health literacy in wave two, which is kind of about, but not specifically health literacy in context of information available online. And I think a lot of the questions, honestly, I mean, there's limited real estate on the survey. So we are kind of, I mean, it's more, so it's more a breadth rather than depth. We go into the depth of a few issues, but I think the attempt is to capture a lot of indicators and provide breadth, and then provide ideas for researchers like yourself to delve deeper into specific domains through their own projects and grants.
Thanks, Rahul. Christy has a question about awareness and perception and the link to Smart Nation tech initiatives.
Yeah, I think for this question, it is exactly like what Rahul said. I think that there is a lot of things that, and I hope actually from this talk that you will see that there's a lot of work to do on understanding truly people's technology use and how they use it and what they use it for, and that I think is great. I mean, the IMDA does their yearly kind of penetration on internet and things like that, but that is nowhere near enough to understanding some of the issues that for example, older adults face in terms of internet. I mean, there are other issues among youth, but I think we do need quite a lot more research on this area. And I am always happy if you email me to talk about these ideas and maybe apply for grants. I'm very happy.
Yeah. We have a few minutes left, actually, till 1. Anyone want to ask a question to Shannon?
No, I mean, the thought just came to me, Shannon, I guess. I mean, we didn't really look at it when we were doing the analysis, but we have information at least on a proportion of them on their hand grip strength. And that
Yes.
may be like a decent proxy for fine motor
yes,
skills,
yes.
if at all. I mean, ideally, we should have like a finger strength and thumb strength. But of course, we don't have information on kind of really thumb strength using a pinsometer or using, but we have a dynamometer that we used for hand grip strength, which could be kind of used. So I think maybe separately, I think we could just see if there's something going
Yes.
on with health-related difficulty and grip strength.
Yes, yes. Why didn't we think about it? Yeah, okay.
Yeah. I mean, there's always an improvement.
Yeah. Questions?
How do you think the context of coping with the crisis matters?
Natalie.
Yes. So Natalie, I think so. This study, just to clarify, even though we've been talking a bit about COVID-19, this study is not about COVID-19, right? The study was conducted in 2016, 2017. I think that the COVID has probably made it a lot worse. I think people are now generally more aware of the use of internet and how and the kind of benefits and non-benefits it brings, including older adults who may not have access to it, and therefore Rahul wrote a paper on an article about this and how they are generally more socially isolated because of the pandemic. Context of coping. Yeah, I think it amplifies that especially if we, I mean, we didn't do this, but if we had done the survey, for example, right in the middle of the pandemic or after, I think we would have seen that a lot of these associations would be stronger. At least that's what I would expect. That the disparities between people who are able to access it, who are able to use the internet and not able to use the internet, are going to be larger. So that is, I guess, a simple way to put it, but that is what I guess I expect. The variance would have increased.
Yeah. Final question? Actually,
Hi,
I have,
say,
yes.
Can
Okay.
I say something?
Yep, sure.
Ling Ling here.
Hi,
I'm
Ling Ling.
just wondering that, we talk a lot about, well, all these limitations on health and all, and we obviously think that the smartphone probably has to change to, I mean, you should have certain models for older people, but what is your sense of that translating for commercial, how much, is it like the companies, the manufacturers are forcing older people to use what they want? Because, as you say that people don't use dumb phone because smartphones are the only available model. Yeah, so how do you see that kind of translation possible?
Yeah,
I think in Singapore, it is generally more difficult, and because the market here is slightly smaller. I think in the US, they do have certain solutions. So actually, one of the things that I was trying to do for my grandfather was to set up, like, for example, a tablet, right, that just stands there and it answers itself. When I call, it answers. Like, it doesn't need anyone to touch on it. But then you go into kind of privacy issues and things like that. And how do you limit the people to be kind of the people that you want to access to it? So there are some ways already that we can do some of this. For example, that was what I was trying. I think economically, to make a specific smartphone for older people, I think we have to divide, kind of like divide the issues into two things, right? One is what kinds of issues are going to be long term, right? Like all older cohorts of people are going to face, right? So these are age effects, not cohort effects, right? We have to separate the age and the cohort effects, because one, if something is an age effect and everybody in the future is going to face it as well, then there's a more the market is there's longevity for the market, and it's a more kind of commercially viable product, right? But if it's a cohort specific problem, in the sense that maybe the pioneer generations and Merdeka generations have issues with the internet that we're not going to see later on, then of course that would be much less of a draw for, I guess, commercializing a product, right? So and so that goes, I guess, it goes back again to research and being able to kind of separate out these age cohort effects because that has implications on whether these things are even commercially viable in the future. At least, I mean, that's how I generally think about it.
Okay, we have 2 minutes to one. I just thought I would wrap this up by asking a question, a sort of a big question, and then to hear your response before we end. You know, when it comes to aging, and if you look at the national discourse and even the discourse that's coming up from the ministries, right? It's always been about aging in place, right? Aging in place, but actually your research is telling us that the elderly are aging in networks with the internet use and so on. What do you think about aging in place? Is that an accurate depiction of what elderly are in fact going through in Singapore today?
So I'm going to answer this question by kind of slightly turning it back to you because because you are the expert on networked individualism, right? And so network individualism basically says that in the internet age with a lot of these communication tools and things like that, networks are going to be based more around people than they are on things like geographical area or by family and things like that. I think this is a very interesting way to look at internet use among older people, right? Because for one, aging in place is more a health thing, right? Because people want them to age in place, both in terms of we want to stay where we are, because we like it where we are, but also because there needs to be a certain ecosystem of care that goes on there, and that is physical, right? But at the same time, we're also seeing this online bifurcation or kind of like individualization of networks. And so a lot of social support could be from someone who actually lives far away. And I think this is a very good question, because then we can see how these local and virtual networks come together and how they work for older adults, right? Especially for older adults who require a certain amount of physical presence and care compared to, for example, younger people who don't need that physical proximity so much. And so yes, I mean, I think that's a very interesting area of research to look at. I think aging in place is, I guess, the
sort of assumption
buzzword right now that's going around, and I think it has its users, but at the same time, I think we also need to recognize that, for example, you can live in the same place, but people in the neighborhood may be somewhere else, or maybe completely virtual, or maybe online, even in their houses, and you may not get that kind of help. So being able to marry the two different trends, I think, is key here.
Yeah, I thought what you said about the difference between cohort and age effects are very interesting, because it may be the case that with every generation and increasingly, internet use would in fact become normalized. Shannon, thank you very much for taking this time to share your research with us. Very interesting and compelling, with wonderful questions from everyone. So thanks a lot, and to the audience. It's time to say goodbye, and wish you a good weekend ahead. Right? Thank you. See you.
Thank you.